This is Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and welcome back to Sketches in Surgery. This is a video series where we use illustrations to try to explain plastic surgery and its components. I hope you are enjoying these videos, and if you're new to this platform, please subscribe and like. It really will help me kind of grow this channel and hopefully get new ideas from you as to what illustrations and explanations would ring true for you. So we're going to continue our series with genioplasty, and genioplasty is just basically using your own chin bone to accentuate your profile by even moving the chin forward or backwards or to one side or the other. We can certainly significantly change and improve any discrepancies or asymmetries of your face. So one important thing that I've seen in various forums is the location of the incision and what happens to the muscles that surround the chin during surgery. So I want to illustrate here in my drawing what we're looking at. So we're looking at a side view of the lower jaw, which is this is the lower front tooth on one of them. This is the opening where the nerve enters into the cheek and gives you feeling to your chin. On the particular side, whether that's right or left, you have a right opening and a left opening that gives sensation to the chin there. You're looking at a side view of the pinkish area that represents the gums up to the red part of the lip. Obviously this is the skin of the lip. This is the what we call the orbicularis oculi muscle, orbicularis oris muscle, and that's a fancy word. That means just the muscle that kind of, if you're looking yourself in the mirror, that kind of circles your upper and lower lip and allows you to kind of purse your lips to suck through a straw, move your lips in various dimensions. This muscle right here is the mentalis muscle, and in a lot of forums a lot of people talk about the mentalis muscle, and the mentalis muscle is a very important muscle. It kind of gives you definition and support to your chin and lower lip. In genioplastic surgery, this muscle is cut, and repositioning of this muscle is really important to prevent a well-known deformity within the world of genioplasty or chin surgery called a witch's chin, and we'll talk about that here briefly as we move forward. But what I want to do is really kind of focus on where the proper place to place the incision. The incision is placed in the mouth. Now we've had people in forums ask, well, why can't we place it down below and work on the chin? In my opinion, there are two reasons why. One, this will allow us access to the chin, but it will also strip away all the supporting fibers of the mentalis muscle. And so when we make our cuts here in the bone to move it, and let's just try to draw a cut here. Let me kind of grab my pens. I have this amazing desk that you can write on. So if we were to make an incision here in the lower chin crease, so we make an incision, we kind of tunnel down to this area, this little blue line, and I'll kind of zoom in. This little blue line is the periosteum, and that's the covering of the bone. It's like a leather covering. You incise through that and you get to the chin, and you have to strip all that off, that blue covering off the chin, so you can expose it. But you would also have to strip away all that support of the mentalis muscle. I'm just going to take that away. You strip that away, and what that does, it causes that chin, and I'm going to back out a little bit. Let me back out, sorry. Back out a bit. It causes loss of support. And so when we make our cut, it's a rough cut now. we don't have that muscle that's attached to the chin, which attaches to the outer surface of the chin to allow us to move not only the bone, but the muscle and the soft chin forward predictably. So let's say it's a 1-to-1 movement, and usually it's about an 80% movement. If we move this 2 millimeters and we disconnect from this approach, that supporting mentalis muscle, then we don't know if we're going to move this 2 millimeters. If we move the chin bone 2 millimeters, we don't know if we're going to move the soft tissue or the profile 2 millimeters. So it makes it really unpredictable. Two, this incision is not really that small. You really have to make a very generous U-shaped incision almost in the base of the lower jaw, and that crease just between the chin and the start of the neck, to really access this. So this is not a really good incision, and plus, it's an external incision, and so it's hidden beneath the lower jaw, but still can be seen in various views if you're laying down, so on and so forth. So we tend not to use that incision. It just doesn't make a lot of sense. So let's redraw some of our structures here. So let's connect back our mentalis muscle. So we connect back our mentalis muscle. We have, I'm going to connect back our skin underneath our chin. What we want to do now is we want to really make an incision, and I'll zoom back in. And there we go. We really want to make an incision right about here. We want to make an incision, and I'm going to further delineate this. We want to make an incision in the red part of the gum that's loose. There's a firm fixed part right here by the tooth, represented by these lines, and there's a loose part. We want our incision here, because if we make our incision there, it allows us direct access. So let's make our incision. So there's our incision. It gives us direct access. It leaves a little cuff of loose tissue so that we can easily bring these loose ends back together, and gives us direct access to the mentalis muscle. And yes, we have to cut through the mentalis muscle, but we cut right through there just like that. So we cut the top fibers and we get right to that periosteum, that blue part, and we cut through there and we expose just enough of the chin just to make that cut. Now we still got a good amount of attachment here, that when we move the chin bone, because it's attached with its mentalis muscle, it's attached to the soft tissue. If we move this 2 millimeters, we can predictably say that if we're going to do 1-to-1, just to make things simple, we can say it moves 2 millimeters. So keeping that attachment is important for the chin segment so that we can get predictability of outcome. So that's one of the reasons this incision is great. It's inside the mouth, the second reason, and it's not really seen at all. So no matter where you are, what you're doing, what position you're in, no one can see this unless they pull down your lip and you show them. So that's another great thing. So this incision is a wonderful, wonderful incision to use, and we want to make sure it's in that loose part. If we make that incision, let me just redraw this, and let me redraw the muscles. If we make that incision higher, they come up. If we make that incision here, then that incision is prone to problems. And the problem it's going to have is that you've got now this end here that is tight, and that end that's tight. You're still in that tight attached red part near the gum, and it's too hard to close. You put a stitch in there and this rips through and it exposes the bone. And you put your stitch in. Let's try to put a stitch in. So we're going to put one stitch in to try to bring this together. And what happens is that those ends are too tight and it opens up and creates a larger wound because this breaks down. And now we've got a wound that happens here, or we got a weird attachment. If it does heal by scarring, we've got a weird attachment here that allows for gum disease. I'm having trouble controlling my pens. Allows for gum disease and breakdown of the bone. So this little thin area is not tough enough to keep trauma from food and other things kind of destroying this and destroying the bone. And bringing that bone down, even though you've got kind of this tissue that's now kind of scarred in. Just trying to draw it scarred in. And now our bone level, because we made the incision too high, is down here. Let me bring that up. I hope you can see that. Now the bone level is here. It was up here. Because our incision was wrong, we caused gum disease. And now that tooth is in jeopardy because more of that tooth is exposed with this weakened gum area. So we don't want to make the incision there. We definitely do not want to make the incision there. So we want to make the incision in the depth of this loose tissue. So let's just take that and redraw everything in a normal configuration. We're going to redraw our bone at a perfect height to protect our tooth. We're going to reestablish our gum tissue. Let's go back here. Let's reestablish our gum tissue and loose tissue. So we want to make sure that we do that. Now, we know that we don't want to make the incision in two places. We don't want to make the incision here in the attached tissue. We don't want to make it down by the chin. We want to make it here. We want to just cut through the muscle. So let's again make our incision. Let's cut through the muscles to get to our chin bone, and let's just expose just what we need. And let's say we move our jaw forward. I'm going to see if I can do this. So let's do that. Let's pretend we're moving the jaw forward, let's say a couple of millimeters. So let's do that. And I'll try to make this as accurate as possible. That forward, and now let's move this forward a bit, and we're going to move this forward, a little stronger profile, and now we've got the tissues, the muscles that move forward. We want to reattach this upper mentalis muscle because we don't want that to fill with scar and not support our lip so that our lip looks like it's turned down or looks like it's at a lower level. It's not here kind of covering hiding the bottom teeth. It's down below, and that is a witch's chin. So it's very important, very, very important that we reestablish the continuity of that muscle with stitches so that we have that lip chin supported so that we don't have the lowering of the lip level, the exposure of the teeth, exposure of the gums, and also, we'll put a stitch here to kind of close the gum layer, to expose those areas and allow us not to hold our liquids. So not only is this a cosmetic problem if you don't reestablish this, but it's also a functional problem. It can actually cause oral incompetence. So we definitely don't want to do that. So placement of the incision for your genioplasty is extremely important. You can see my messy desk here, but it's really critical to make sure that the incision is placed in the right location. Make sure that as little mentalis muscle is stripped off the bone so that we can get predictability of movement of the soft tissue or chin. Let me kind of back in of the chin. We want to make sure that we reestablish the mentalis muscle so that we don't lose support of our lip and our chin, so that we have lip incompetence or a witch's chin deformity. So important points, things you should know if you're considering a genioplasty, so that when you talk with your surgeon and he or she is able to explain that or give you great detail about that, or even talk about problems where they've actually had this and solved, then you feel confident that you're in the right place. If you're interested in a genioplasty and you're here in the United States, or hey, you're abroad, you want to talk with me, you certainly can do that. You can always go to my website at www.esjaesthetics.com, and that's esjaesthetics.com, and go to our contact us page and fill out our little contact form. We do virtual consultations. Of course, we always do in-person consultations, and my purpose is to give you all the information that you need to have so that you can make the right decision for you. So I hope you've enjoyed this video. Look for more videos regarding genioplasty in our gallery or our playlist here on YouTube. And thanks again for watching. If you again please subscribe and hit the like button. Take care. We'll see you next time.